Hello, my name is Jody. I'm proud to be here at University of Minnesota. Institute of Community Education. We are following the Department of Minnesota, the Department of Education, CDCS, the bring website and try to make it work and part of the plan. Pictures of that webinar will come on a variety of topics around employment services, support, and policies in Minnesota. Today webinar is titled Employment Policy. How does that work? There are a lot of changes happening in disability and employment policy. It can be confusing, but I can what it all means. Many policies and initiatives have been designed to support and encourage employment. But this all means changes in our system. They can be hard and a little scary. This webinar is designed to answer some of the pressing questions. You may have an advocate, family member, or professional enjoy this webinar.
Welcome to our webinar today on employment and policy and how does that work. Today we have a group of panelists and I'm going to have them each introduce themselves and we'll start with the folks that will be doing the interviewing. I'd like you to introduce who you are, where you are from, and how you're connected in particular to the disability field. And we'll start.
Hi, my name is Heidi Meyer, and I'm a self-advocate, and I'm adopted and born with all my disabilities and grew up in the system. So I know some ins and outs since I was 18 years old, and I'm very well known in the disability community and doing self-advocacy work, and I pretty much know this whole panel, which is pretty cool.
All right.
And so that's pretty much what I do and I work with the U of M and do some stuff with them and just enjoy helping people with disabilities make a difference.
Great, thank you, Heidi.
My name is Jody VanNess, and I am mom to a 27-year-old son who lives with autism. I've been involved in advocacy alongside my son, but I've also been involved in the professional community as well. And one of the areas has been transition and employment. So I'm very honored to be here today.
Hello, my name is Ashley Bailey. I am a self-advocate. I have cerebral palsy, and throughout my life I've been in the system, but in the recent years I've been fighting for employment, and I really hope to find new and better ways for people with disabilities to get the employment that they want in the employment goals that they have.
Thank you, Ashley. Now we'll move over to the other group over here and we'll meet the people from the Department of Human Services.
My name is Alex Bartolic, and I'm the Director of Disability Services at the Department of Human Services. And we manage many of the funding streams and the policies to help make employment a reality. And I just want to say that in my career, I've been a teacher, an early intervention, and a case manager. I've worked at counties and the state level, and this has been something we've been working on for a while. So I'm excited to see where we're going to go next.
Thank you, Alex.
Hi, I'm Dawn Bacon. I work with the Department of Human Services in the Disability Services Division, and my role is called Employment Coordinator. So my role is really focused around looking at how we can increase employment outcomes for people with disabilities. And I started out in the field providing services directly to people with disabilities around employment support. So that's where my passion and my heart is.
Thank you, Dawn, and I should probably let people know who I am, this voice from beyond. My name is Mark Olson. I am a project coordinator at the University of Minnesota Institute on Community Integration, and we are working to make sure this webinar series gets out so that people can access the information. We're going to get started with the questions, and I'm going to throw it over to Heidi, and she's going to ask the first question.
Dawn, I heard Minnesota has an employment first policy. Does that mean everyone who wants a job can have one?
Minnesota adopted an employment first policy as part of our Olmstead plan in September of 2014, and this really was a big step forward for us, and we joined with many other states across the country who have established similar policies and initiatives. And really, when you think about employment first, what that's all about is right in the name. It's about putting employment first for people with disabilities. It's about making employment a priority and really elevating the importance of what employment can do for people's lives and taking action around that. You asked if it means that everyone who wants a job can have one. And, you know, finding a job when you're looking for work is never easy, but this policy really represents a commitment by state agencies that anyone who says they want a job will be listened to, and that services and supports will go into play to support that goal. So this policy really represents a strong commitment, and we'll know that we're successful on that commitment when we see more people go to work.
Alex, what will the Olmstead plan do for Minnesotans with disabilities? And will it help me get a job?
You know, Ashley, Minnesota's Olmstead plan is really a blueprint for how we're going to move forward in Minnesota to help people with disabilities, including people who want a job, get a job. It is named Olmstead after a Supreme Court decision that really affirmed the Americans with Disabilities Act and states' requirements to be able to assure that people are not isolated or institutionalized and that they have opportunities to participate in the community. And in Minnesota, our vision for our Olmstead plan is right in the beginning, and it says that people with disabilities are living, working, and enjoying life in the most integrated setting. It has 13 areas of focus, and one of them is employment. And what's unique about Minnesota's plan is it crosses all ages, it crosses all populations and all types of disabilities, and it requires 8 different state agencies to work together to figure out how to make it happen. So we're working with the Department of Employment and Economic Development to figure out how vocational rehabilitation services and the Department of Education and the Department of Human Services can work together differently. We know if you want a job, you need to get to a job. So transportation is part of it, so we can figure out how to help people get to work. So it's really important as far as setting some goals, setting some expectations for how states are going to work together. And we have a sub-cabinet that was appointed by the governor of the commissioners of these different agencies to work together, and they meet every month to talk about our progress, where we might be running into issues, and the federal court reviews our plan to make sure we're on track with it. So it should help people get jobs.
Alex, I've heard that there are other federal rules in addition to Olmstead that will result in service changes. Can you talk about what those are and what they have to do with employment?
There are 2 federal rules. This is just a time of incredible change in our system. So in Minnesota, we said we want to work together differently with our Olmstead plan, but the federal government is making changes as well. So one change that started in 2014 was the Workforce Innovation Opportunity Act. And this is a rule that affects how vocational rehabilitation services operates. And it talks about how are we going to increase employment how are we going to make sure that people, while they're still in school, get opportunities so when they leave school, they can go into the workforce? And much of this particular federal rule is administered through vocational rehabilitation services at the Department of Employment and Economic Development. The other rule is the home and community-based service rule. And home and community-based services include our waivers, such as the developmental disabilities waiver and CADI. We have 5 different waivers in Minnesota. Yeah. And it also includes some of our personal care services and other services. And basically, the federal government said, we're spending billions of dollars. This is no longer a waiver to institutional care. It's not the exception. It really is what people are using, and wanting to look at some standards to assure that we are, in fact, having our programs and policies assure that people have opportunities to live in the community, work in the community, be as integrated as possible. So they set some new standards. And 2 examples of things in the rule. One is it talks about person-centered planning. And it says, what is this? We've been talking about person-centered planning for decades. And there's a lot of really good things that have been going on in Minnesota. But it's raising it up a notch, and it's saying everybody needs to understand what their plan should do and be able to really direct their services and support. So that's one thing that we're doing from the rule. The other one, the other change is that it's talking about the characteristics of where people live, where they work, where they engage, where services are delivered, and saying that services should be delivered in the most integrated setting, allow people an opportunity to interact with people who don't have disabilities, and expecting states to go through an assessment of how well our current services and standards meet that, making changes and not paying for things if it isn't going to help people be as included in their community as possible. So this rule is going to have a number of changes, particularly in our home and community-based services. We have a transition plan, so we had a 5-year period to work on it. We're working right now with a number of stakeholders to say what are the characteristics that we want our services to have, what won't be allowable in the future, what will be the standard going forward. And we're going to be bringing a legislative proposal to the legislature in 2017 about what these new standards will be. And then from there, we'll go about finishing the transition as we go forward. So we're excited about it. I think it's really going to help us understand a little bit more when people say what they want in their person-centered plan, do we have the right services available to help them achieve those goals?
And I have a question to ask you about that.
Okay.
Is the county social worker going to have most of the control of how to sign you up if you need a job coach or need rehabilitation services? Or do I get a choice of how I want to pick and do it?
Well, that's
because
a
it
really...
used to be that way, and that's how I got my first job, because they didn't know what to do with my disability, so they just ended up putting me in McDonald's, seeing how that would work. But they didn't try a whole bunch of different things. Like now, I probably would have that chance.
Yeah, part of the person-centered planning requirements are that you get a lot of opportunities, and a decision you make today doesn't have to be the decision tomorrow. Maybe you went and worked at McDonald's and now you want to try new things out, and we have to figure out how to support that. So the case manager, your case manager does play an important role in helping with the planning and helping to give options to you, and in the end they also help make sure that services are authorized. But if you want something different, part of the planning should help say what could be different, and then helping you understand who's out there that could help you go to the next step of exploring different options.
Cool. Dawn, can anyone with a disability work in the community, like me, as an example?
Yeah. So when the question comes up about why there are so many people with disabilities who aren't in the workforce, one of the things I've noticed is that the discussion tends to focus a lot about disability itself and at the individual level. But there's a lot more to the story. That's not the whole story. We really need to expand that conversation. And there's actually examples of characteristics around people's disabilities that even bring unique strengths into the workforce. So if you're familiar with Dr. Temple Grandin and her story, I think that's an excellent example of that.
She proved that you can do it.
Absolutely. So this really brings us to think about our core beliefs about disability, and to really understand that it's important to recognize that our policies over time have reinforced and even formalized some assumptions about disability that have later proved not to be true. So one example of that would be the notion that a person with a disability needs to get ready. We call it the readiness model, but that they need to practice skills in a facility-based program before they can graduate to the community. Well, what we've learned with supported employment is that actually people often learn best by starting in the environment where a skill is needed, and that that's something that's true for all of us. So with your question, I think, you know, we've really reached a new crossroads with the Employment First policy and in the work that's been going on, where it's no longer okay to tell someone that they can't work. That whether or not work is right for a person at any given time is really something that only they can answer. So it can be challenging in this conversation because I think a lot of us think about people that we know with some very significant complex disabilities, and it's hard to envision them working in the community. But the fact is that people with very significant disabilities have gone to work successfully and do work. So I can't be aware of that fact and then presume to tell someone, you or someone else, what they're capable of. So as a disability professional, in particular, it's really letting go of some false expertise that we have taken on over the years and really shifting our focus to listening to people. And when someone says they want to work, to really focus on how can I support that? And how can I learn everything I can about supporting that?
Don, why can some workers with disabilities be paid less than minimum wage? And is that even legal to do?
So paying people with disabilities less than minimum wage, some people refer to it as subminimum wage, that is legal. And federal law allows this for a person based on being paid on what's referred to as a productivity measure. And simply, you know, to try to put it in a really basic way, there's testing where it's looked at how people without disabilities would perform in a typical position, and then a person with a disability is paid in comparison to that. Now, subminimum wage, or paying people with disabilities less than the minimum wage, is something that's being debated, and there's a lot of different opinions and feelings about that issue. I think one thing that's really important to keep in mind is that not all jobs require productivity in the way that we talk about it when we talk about subminimum wage. So those are not the only kinds of jobs that people with disabilities can do. And unfortunately, there's many people with disabilities who have been deemed unable to work based on just a few specific jobs related to the subminimum wage factor. So we really want to open up and think broadly about job matching and really look at where other jobs come into play, that some people are really paid much more based on quality than, say, productivity. So subminimum wage jobs are legal. They are an option for people, but where we're really focused on at the department is growing opportunities for people to earn minimum wage or higher, to find jobs that really fit with their interests and their skill set, and really to earn as much money as possible, because that's what people want.
Alex, will sheltered workshops be closed in Minnesota?
You know, that question is asked a lot. The term sheltered workshop means different things. It might mean a center where everybody works, some people at subminimum wage, as Don was describing. It might mean a program that is otherwise known as a day training and habilitation program, where work is part of it, but there are also other activities. So the term is a general term that might mean a lot of different things in different communities. Our biggest goal right now is growing options. It's how do we make options available for people? So if people want to work in the community, how can we make sure that we have the right employment supports that can help people discover new jobs, try new things out, be able to get coaching they need to do that. But we also know for some people, they also are interested in community activities. For some families that have people still living at home, their adult children, they might need a predictability in the schedule so they can go to work. And so how do we really look at an array of services that can support people in the community in lots of different ways? You know, the HCBS rule that we talked about a few minutes ago does talk about what are we going to define in Minnesota as far as services that meet the standards of home and community based. And what do we have? Right now we know that there's a lot of different components of services that need to be there. It includes respite. It includes time for people to be with friends and socialize in a way they want to. And how do you get to places? And so I think our focus is going to be on building those options for people, letting the funds follow the choices that people have, and being able to pay for their supports as we go forward.
Dawn, I heard I will lose my benefits if I work too much. Is that true?
No, not necessarily. There are a lot of myths about how working will impact disability benefits and healthcare coverage. And unfortunately, fear of losing benefits keeps a lot of people out of the workforce who want to work and would be better off financially and in other ways if they were working. There are some really great policies and rules that have been set up to help people reach their work goals. Social Security and other state and local agencies have realized that people with disabilities want to work and they want to support them. Many programs now have rules that allow people to keep their benefits, some or all of their benefits while they're working, or if they go off a benefit due to working, they're able to get back on that benefit quickly. And according to surveys, the #1 benefit that people with disabilities are afraid of losing is their health care coverage. Medical Assistance for Employed People with Disabilities, or MAEPD, was created to help overcome that fear. And MAEPD allows people to keep their medical assistance, or MA, while they're working. With MAEPD, people pay a monthly premium, and there's no upper income limit with MAEPD. There is an asset limit of $20,000 that doesn't count against things like a person's home, their furniture, and one vehicle. And their earnings with MAEPD are not considered when determining disability. So that means even if you lose your Social Security or SSI benefit, you could continue to keep your MAEPD. So it's important to learn about the different programs and how they affect you, and there's a lot of resources set up to help people get support with that. The Disability Linkage Line is a great resource. Their phone number is 866-333-2466, and there are statewide options counselors who can provide one-to-one assistance to people to learn about their options and connect to resources.
And I'm an evidence. I've used it.
Great, excellent. Have you used DB 101, disability benefits?
I've actually been to the workshop.
Okay, great.
So I actually know what it's about. You know, I sat through a whole hour.
Heidi, you don't have a microphone, so. But actually, we have a question about DB 101 coming up shortly. Okay. So we'll go on with the questioning, and then we'll get to the DB 101 question and get all those answers out.
Okay, I can do that. Okay.
So DB 101 is a website and has a ton of information about federal, state, and local programs and benefits for people with disabilities. It also has tools to help people understand their benefits and plan for the future. So some people may maintain both work and benefits. Some people might go off their Social Security benefits, all of them or some of them, because they reach a level of earnings where they're no longer needed. The important thing is that people understand and get the information so they can know what's best for them. And the big messages here around benefits are being on benefits does not mean you can't work. And living on benefits does mean living in poverty. These are poverty programs. So work really pays in this situation.
Alex, what is DB 101 all about? And can anyone use it?
Well, and Don just talked a little bit about it, and Ashley, everyone can use it. Disability Benefits 101 is a web-based tool. It's on the website. We developed it using some national expertise, and it really is a way to go in and look at the kind of benefits you might receive and what would happen if you worked more hours, if you made more money, and it will walk through the effect on your benefits. It's a great resource, and as Dawn mentioned, anybody can go online and do it, and you can do it over time. You might have done it once, and then when you're moving from your McDonald's job to another job, you went to see what would happen if you made more money, and you can kind of track through that. It also has people available to talk with you and to help understand if you have any particular questions, so you can kind of get to an expert as you're going through it. And there also is information when you go on the website. And when you go into the Minnesota Help website or the Disability Benefits 101 website, where there's a partners page, and that will help you if you are a professional or somebody is working with you, be able to get some additional information. But it's a great tool, and it's been very, very helpful for people.
And I know that you do workshops around the Twin Cities, you know, and talk about it, because it was at a housing conference, and a lot of people were very interested, you know, in it, and I took it to see what it was all about, you know. So it's very packed, so you got to come with your head a little empty, and so you can soak it all in and learn all about it, because they walk you through each part of it.
Well, and that's a good example. And that is an example, too, of if you want to live someplace, instead of just looking to see what you can afford with public subsidies, finding out what you can earn and how you can pay for rent and be able to live in a place you enjoy is a good example of why making work part of the plan is important.
One thing I've learned from that program is that website is some people with disabilities might need a little help, so it's good to bring a friend or a worker or someone who can help you navigate it, so you can do it, because you talked about that if you need guidance.
Yep, you can bring a friend, or you can call up and get some help through the online chat, or go to a workshop.
Mm-hmm.
All right, that was wonderful. A nice little chat there. Heidi, would you ask the next question, please?
Is it Alex? What is DB10?
Oh, already did that one.
Alex, what is? Oh, Alex, what? Let me try this again. Alex, I want to work in the community, but my support team does not agree with me. What do I say to that?
Well, we're going to start with person-centered planning, Heidi, because it really does.
You definitely are with my team.
With your team. I think to be able to really go back and learn what you're interested in and finding out what they're concerned about. And a lot of the person-centered planning is finding out what's important to you and what's important for you. So finding out what your support team is concerned about. What are their thoughts about why they have some concerns with that? Are they worried about how you'll get to work, if the right support will be there, what happens if you lose your job? We need to find out what their questions are so that we can be able to work through the plan and figure out ways of addressing those questions in different ways.
You need to come to my meeting. Those are the questions I've been wanting forever.
Well, I think that we are doing some training for assessors and case managers, as well as a lot of service providers, about person-centered planning. There's some tools we can use to really break down some of these conversations and figure out different solutions on how to do it. And you can ask other people to be part of your planning process
I think that
to support
will
you.
leave, if I'm saying it right, make the person who's getting the job feel better, because then they don't feel like, I'm going to lose all my benefits. This way, if we can figure out, if this job doesn't work for you, or if it's not a good fit, there still will be backup. And I think that's the number one thing we need to work on and think about and stuff. You know, not everything goes bye-bye.
That's right. And you know what? For all of our lives, things happen sometimes, and so we need to just be able to keep planning.
All right, Dawn, are there ways people that are supported can be self-employed? And would you tell us a little bit about past plans?
Sure. Self-employment can be a really great option for people. I've seen it be a way for people to have a whole new level of flexibility around how they plan for their employment, and certainly brings in a level of customizing the job, make it more specific to maybe what their needs are. And so it's a great option for anyone. It's a great option for people with disabilities as well. A PASS plan stands for Plan for Achieving Self-Support, and it's a work incentive with Social Security that allows people to set aside money in order to achieve a work goal. So it helps you pay for things connected to a work goal. Things like tuition or books or training, equipment necessary to do your job, a vehicle to get to work. Those are just some examples. And PASS plans are very underutilized, so they're a huge untapped resource that could really be worked more to help people support their work goals. One thing to know about PASS plans is they're not specific to self-employment. They can work great for people who are self-employed, but they can also be used for general employment as well. And if you want to learn more about either self-employment or PASS plans, you can go to Disability Benefits 101, db101.org. If you type in the search function self-employment, there's some really great articles that come up that help people start to think about that as an option for them and do some planning around that. There's also lots of good information on PASS plans on DB101 as well in terms of how to get started with that process.
Alex, I've heard about some changes to CDCS. What are those, and when and how broadly will they be available?
So CDCS stands for Consumer Directed Community Supports, and it's an option through our waivers where people can choose to self-direct their own services and employ their own staff. It's a great option, and one of the things that has changed last session, the legislature did approve a 20% increase in the budget that would be available for CDCS for vocational supports. And so we have to get federal approval now, and we are submitting those into the federal government for approval. We expect to get them in April. We've already gone through a public comment period, and we hope that this summer that will be available. I do want to say with that, though, that CDCS is a great option when people want to direct their own supports, but all of our waivers should be self-directed. All of our waiver services should be where people have a plan, and if you want to go through providers and have providers help you with your services, you're still directing that. So sometimes we look at CDCS as being the only way to direct your own services, and I hope that's not what it is. What we really want is that people are able to design their plan and work with providers to get the services they need, and if they want to take the extra step and actually hire people and make more of the decisions and management decisions, they can go to CDCS. And this expansion for vocational supports in the budget will be very helpful.
Alex, access to timely, affordable transportation is another key to fully implementing employment and all supports to better meet Olmstead. What is happening to improve this great resource?
Transportation is one of those services that's really difficult to be able to make available across the state, and it's because our state's different. What we do in the metro area, where we have buses and metro mobility and the light rail, is different than what happens in some of the more rural areas. The Olmstead plan is looking at things about how do we make transit available, how do we make our state more accessible, and even things such as curb cuts and being able to assure that people have access to get around their communities is important, and that is one step. We are working with the Department of Transportation. Certainly for people on the waiver, you can use waiver dollars to pay for different kinds of transportation, but what we want to do is make it available broadly. There are some regions of the state that have done some really nice things where they have looked regionally at how to create transportation. And they've developed, for example, in one part of the state, a call center where they will help coordinate transportation between volunteer drivers and different van rides. And that works in that part of the state, but we need to develop more and more of that. The Olmstead plan and some of the work with the Department of Transportation does have work going on with the transportation planning in order to look at these transportation mechanisms across the state.
Alex, has the ABLE Act been put into practice, and if so, how does that fit with the rules about earning assets as it relates to benefits?
So the ABLE Act was passed to allow people to be able to save money. And if you're familiar with college savings account, there's a certain amount of money that can be put in, and it's basically tax-free. And this is a similar way where there can be up to $14,000 a year invested into an ABLE account on behalf of someone, where it's either their savings or someone else can put it in. It doesn't affect their benefits, and it can be available at a later time to be able to purchase services and supports without affecting their medical assistance eligibility. Right now, the ABLE Act, while it's passed, and we do have a law in Minnesota that allows it to come into being, it's not operational yet. And Minnesota has joined with 18 other states to issue an RFP for a vendor that will make this available in our states. We'll have our own Minnesota brand of what this is, but by working across states, we're hoping that the fees associated with this will be reduced so that it will be something that people are really interested in using. We hope that it will be available later in 2016. So it's going to be an exciting opportunity for people to be able to have an account that they can use later to pay for services and supports.
I want to ask one more question. You guys mentioned people getting jobs with the skills and abilities they do have. Is there any way you're gonna track how individuals are doing in their jobs, and if they feel it isn't meeting the skills and abilities they do have?
You know, that's a really good question, and that's the heart of Olmstead. So there's some things we know that we can track. We can track how much money people make, but what we don't know right now is what kind of job people want and if they're in the job they want. So we're working with the Department of Education and the Department of Employment and Economic Development and the Department of Human Rights and the State Council on Disability as well as DHS to try to look at how are we going to offer informed choice and be able to collect information every year about whether or not people are having the job they want and making the kind of money they want, and what the barriers may be so we can understand what supports we might have to put in place. But meanwhile, there is some good information we are able to get just on understanding how much money people make and being able to help counties understand what they can be doing differently to support people.
Now we reached the end of our actual, this is Mark, voice from above. Hello, everyone. It's Mark, the voice from off camera again. And we've reached the end of our prepared question session. And I would like to, Ashley already did this, which I think was great. She asked a follow-up. I want to ask Jody and Heidi if they have any follow-up questions based on what they've heard. So I'll give them each a chance to ask one, and then we'll close it out after that. So
I like the question that was answered earlier about data, because it's very hard to do some of the services and human services and the legislators to make the right decisions, because it seems like in the last couple of years when I'm at the Capitol, they want data. They want proof that the money's being used correctly, no matter what part of Olmstead or Human Services or whatever kind of project we put together for Human Services. So I think that's really good that we're starting to talk about it, and it really cool that it came from a self-advocate, you know, that had the disability, that thought of the question. And now you guys have to take it back and really think about it, because that's all I've heard for the last couple of years. The money won't come without some proof of how is it working, where's the data. So I think that's really awesome that we're bringing this to the front.
And I'd like to just ask for a little clarification if I could. I know with my own son and other families that I've worked with, sometimes it's a little confusing as to what the role that the county case manager plays in relation to vocational rehab services. And I know we don't have time to go into that exhaustively, but can you shed a little light on that so parents have a better understanding how they differ and how they work together as well?
I think, yes, and that is something we're actually working on with Olmstead. We are trying to figure out, one, how to make it so you don't have to figure it out. The system should figure out how to support you, but also how do we start talking about our roles in different ways. And Dawn's actually been working with a work group that's been spending a lot of time on thinking about the policies and the roles. So I'm going to let her start on this question.
Sure. I think I'll just say we've heard that feedback from a number of people. So just really understanding what are the different roles, and how can I put together my supports in a way that makes sense for me, you know, based on a person-centered plan. Both the Employment First policy as well as our Olmstead work talk about the importance of aligning funding, programs, and policies. And I think particularly with the Olmstead plan, it's really bringing us to a new level of interagency collaboration that we haven't done in the past. So we're at the table with the Department of Employment and Economic Development, which oversees the vocational rehabilitation services, as well as the Department of Education, you know, thinking about how schools play that critical role in transition, to really think about how can we design a system and make improvements so that we really have that seamlessness approach, that people really understand each other's roles and how they can fit together to support a person in a holistic way. So that's certainly on the radar, and I think even more so on the radar over the last year, and we'll be seeing some changes as a result of that, a deeper level of collaboration.
I apologize for everyone seeing my head going right across Alex there as I was grabbing this microphone. But would also like to, as we close, actually ask Alex and Dawn if they have anything else that they feel that they would really like to share with our viewers, that is anything else that is going on that is really bubbling to the top right now.
Maybe just to echo how important person-centered practices are. If we focus on the person and really trying to figure out how to wrap around how our policies fit or don't fit around achieving goals for people, we can do that over and over and over again for a person. But if we're trying to find the next model that will work for a lot of people, we're walking ourselves back into the same pattern that we don't want to go into. We know that work can be part of the plan. We know there's a lot of creative things going on. And we also recognize that as we talk about person-centeredness, this is not only how to learn perhaps some different skills in how to plan with people, but it also means as those of us who work in organizations have to figure out how our organizations have to change and the system has to change. I've been in the system long enough to know that some of the odd things that happen are because it didn't support the very outcomes we want to see. And that's what we are really focused on. That's what's different. And that's why it's so important with the Olmstead plan and where we're going is it's not just a division or a department. It really is a collaboration across state agencies. And while that takes time, it also has the potential of some really meaningful change.
We covered a lot of ground today, and I think person-centered planning is a great place to end because it really ties, I think, everything that we talked about together. So certainly as we're moving forward, we're really going to be paying attention to how are we engaging with people about employment. And for years we've talked about people having choices, but we're really taking a closer look at that because a lot of people are saying that they don't have a choice when it comes to employment. So we really need to kind of ramp up our efforts to make sure that people have access to the information and the support that they need to make that choice and to go to work. And you brought up data. I think that's going to be a critical piece in holding us accountable and doing the work, as well as I think really bringing together a collective focus because this change isn't just about a state agency. This kind of change takes a village. So it's going to be across stakeholder groups, self-advocates, coming together to really look at how can we think about things in a totally new way and how can we get to totally new outcomes for people.
That ends this particular webinar session. I'd like to encourage people to look at the other webinar sessions that are a part of this series. And I'd like to thank all of our panelists for being a part of today's event. Thank you and goodbye.